Friends, I am Dr. Shah Hussain Biradar, Khizar Super Speciality Hospital, Vijaypur. Friends, I am back with diabetes series lectures. In last video, I discussed what is diabetes, types of diabetes, symptoms, and general management. Today, I will discuss complications of diabetes mellitus. Friends, complications affect many organ systems and are responsible for majority of morbidity and mortality associated with diabetes. Diabetes has been the leading cause of new blindness in young adults, renal failure, and non-traumatic lower extremity amputation, and is a leading contributor to coronary heart disease. Friends, we can prevent the complications by means of getting glycemic control. That is the only gift we can give it to patients. Once complications takes place, cannot be reversed. It is always better to prevent the complications rather than treating the complications. Complications can be divided into vascular and non-vascular. Vascular complications are further subdivided into microvascular complications and macrovascular complications. Microvascular complications are retinopathy, nephropathy, neuropathy. Macrovascular complications are coronary heart disease, peripheral arterial disease, cerebrovascular disease. Non-vascular complications are GI system, that is gastroparesis, diarrhea alternating with constipation, in general, infections, especially skin infections, recurrent fungal infections, and skin changes, that is altered or hyperpigmented patches on the body, hearing loss, dementia and impaired cognitive function. Microvascular complications of both type 1 and type 2 DM results from chronic hyperglycemia. Microvascular complications, among them we discuss renal complication of diabetes. Commonest is diabetic nephropathy, is the leading cause of chronic hyperglycemia, leads to chronic kidney disease and end-stage renal disease that requires renal replacement therapy. Friends, diabetes is the leading cause for the chronic renal failure that can be prevented by just getting simply glycemic control earliest as possible. The pathogenesis of diabetic nephropathy is related to chronic hyperglycemia, results hemodynamic alterations in the glomerulus microcirculation, that is glomerular hyperfiltration or hyperperfusion, leads to increased glomerular capillary pressure and structural changes in the glomerulus, that is basement membrane thickening and fibrosis takes place, leading to destruction of kidney. In diagnosis, how to diagnose the nephropathy earliest? Friends, it is very simple to diagnose diabetic nephropathy earliest. You can prevent it. Just get the urine microalbuminuria. If it is more than 30 milligram, then label that patient as a diabetic nephropathy. Now, American Diabetic Association guidelines defines albuminuria as persistently, increased urinary albumin to creatinine ratio more than 30 milligram per gram on a spot specimen is labeled as a diabetic nephropathy. Or diabetic kidney disease refers to albuminuria and reduced GFR, that is less than 60 ml per minute per square meter of the body. Then you diagnose that individual as a diabetic nephropathy. Diabetic nephropathy treatment, friends, the optimal therapy for the diabetic nephropathy is prevention by control of hyperglycemia. Just get the blood sugar level controlled earliest you can prevent it, further destruction taking place in the nephrons. Friends, it is very easy to prevent the disease rather than treating the complication. Next, strict blood pressure control. If patient has developed hypertension, you control it. Even hypertension can contribute the chronic renal failure. And control the blood pressure by administration of AC inhibitors or ARBs, that is angiotensin receptor blockers. In case of type 2 DM, administer SGLT2 inhibitor. You can prevent further destruction by administering these drugs. Next, microcirculation complication is diabetic neuropathy. Occurs in 50% of individuals with long-standing diabetes, manifests as a diffuse distal symmetric polyneuropathy and or autonomic neuropathy. Distal symmetric polyneuropathy, or also called as DSPN. DSPN, the most common form of diabetic neuropathy. Most frequently it presents with a distal sensory loss and pain. Symptoms may include a sensation of numbness, tingling, sharpness or burning that begins in the feet and spreads up proximally. Hyperesthesia, that is increased sensation of extremities when you touch it. Paresthesia, abnormal or unpleasant feeling when you put the pressure on the affected nerve areas. And dysesthesia. Dysesthesia means abnormal or unpleasant sensation when you touch the affected nerve root area also may occur. Pain involves lower extremities, usually present at rest and worsens in the night. As diabetic neuropathy progresses, the pain may subside and eventually disappears. But a sensory deficit persists and motor deficit may develop. On examination, often reveals sensory loss, loss of ankle deep tendon reflexes, loss of abnormal position sense and muscular atrophy takes place, and or foot drop may develop. Next is autonomic neuropathy. Individuals with long-standing diabetes can affect cardiovascular, gastrointestinal, genitourinary, reflected by cardiovascular autonomic neuropathy symptoms reflected by decreased heart rate, resting tachycardia, or orthostatic hypotension. These are the three symptoms of cardiovascular system. And gastroparesis and bladder emptying abnormalities hyperhidrosis of upper extremities, that is profuse sweating in the upper extremities and absence of lower extremity sweating, that is called as anhidrosis of lower extremities. Treatment: prevention of diabetic neuropathy through improved glycemic control. That is the best choice of treatment we have, friends. Rather the patient letting complications, it is better always treat the patient earliest and get the glycemic control. Next, lifestyle modification, that is exercise and strict adherence to diet plan. Treat hypertension and hypertriglyceridemia. Supplementation with multivitamins. Avoid neurotoxins like alcohol and tobacco. Smoke tobacco in any form, either it may be chewing or smoking. Chronic painful diabetic neuropathies, administer antidepressant duloxetine and anti-epileptic pregabalin. Next, gastrointestinal or genitourinary dysfunction. Long-standing DM may affect the motility and function of the gastrointestinal system and genitourinary system. The most prominent GI symptoms are delayed gastric emptying and altered small and large bowel motility, that is constipation alternating with diarrhea. Gastroparesis may present with symptoms of anorexia, loss of appetite, nausea, vomiting, and early satiety, abdominal bloating. Diabetic autonomic neuropathy may lead to genitourinary dysfunction, including cystopathy and female sexual dysfunction, that is reduced sexual desire, dyspareunia, painful coitus, reduced vaginal lubrication. Diabetic cystopathy begin with inability to sense the full bladder and failure to avoid completely. Here, patient may not feel that his or her bladder is full and fail to pass the urine. May pass involuntarily, develop incontinence or retention. In case of males, erectile dysfunction and retrograde ejaculation. Treatment: gastrointestinal, small, more frequent meals that are easy to digest and low in fat and fiber may minimize symptoms of gastroparesis. Avoid medications that slower the intestinal motility like opioids, GLP-1 receptor agonists. Treat the patients with acid blocking therapy with PPI. Next, diabetic cystopathy should be treated with scheduled voiding or self-catheterization in case of urinary retention. Advise patient to go frequently for urination at a scheduled time, maybe half an hourly, 1 hourly, so that he should not pass involuntarily. In case of erectile dysfunction, drugs that inhibit 5-phosphodiesterase are effective, that is sildenafil, tadalafil, etc. Friends, remaining complications I will discuss in next series or part 2 lecture. Thanks for watching, friends. Your encouragement and support is very necessary to create or produce more lectures. Friends, encourage me by subscribing my channel and liking it, and share it with your friends or any other doctors you know. Thank you for watching.